It's 2026 and vaccine coercion is still alive and well. I'm talking about parents of children in Ontario schools who are facing compelled medical disclosure or harsh suspension orders for protecting their privacy if they try to defend this legal right. Principals in public health have been known to enact harsh, dehumanizing, and degrading treatment onto these innocent children. And if you don't know what I'm talking about, let's dig in. Ontario parents with a child or children in publicly funded schools should know that Public Health Ontario is still coming for your children's personal, private, and used to be confidential medical records, specifically their vaccine status. They want to track and trace all of it in third-party data systems like Panorama, and I would say this will eventually lead into what the World Health Organization has proposed with their global surveillance architecture. It's all starting with Hamilton Public Health being at it again, sending out these so-called suspension orders to parents whose kids' vaccine records aren't up to their standards. Thousands of students across Ontario could be removed from school for up to 20 days by way of these orders. That's an entire month of lost learning. This is typically reserved for the most severe occurrences. It's the most severe penalty meant only for serious and violent misconduct, such as drug trafficking, assault, or repeated abuse that cannot be addressed by any other means within the school. Even then, principals are supposed to be required to weigh critical factors, including a student's ability to control their behavior, understand consequences, risks to school safety, personal history, or trauma, prior to the use of suspension orders. And they must factor in whether the behavior stems from harassment or discrimination, the student's age, and the impact of suspension on their education. Plus, students who are suspended for these prolonged orders, defined as anything more than 11 days, must be offered a program that combines academic instruction with behavioral supports such as anger management, substance use counseling, or life skills coaching. That's how bad the offense has to be. But under Ontario law, only a school principal can suspend a student, and it must be done according to the Education Act. This legislation ensures that all legal obligations, duties, and protections in the education system are upheld. A medical officer of health has no authority to directly suspend students because doing so bypasses these critical safeguards entirely. Yet public health has pressed ahead regardless, showing blatant disregard for children's social, emotional, mental, and educational well-being when they're removed from school for up to 20 school days. Public health does this under the Immunization of School Pupils Act, called ISPA, and it demands that parents hand over their children's private medical information to their centralized databases. If you don't comply, boom, suspension threats start flying. But again, only school principals can actually suspend a student, and that's done under the Ontario Education Act. Public health can't just waltz in and play enforcer, but they do, and they'll continue to do so because they keep getting away with it. Let's not forget that these prolonged and extreme suspension orders come on the heels of Ontario's school testing data in December that showed half of grade 6 students and 42% of grade 9 students are failing to meet basic provincial math standards, while general literacy in reading and writing lags far behind. Let's also remember that Ontario students endured the longest and harshest school closures in the country during COVID-19 under this same government, with no evidence or justification for doing so. Effects that clearly continue to ripple through their lives today. But public health doesn't care. They just want your vaccine records. And if you don't comply, your child will be the pawn in their bullying and coercive tactics. See, if you try to request that Education Act requirements are upheld and provisions around long-term suspensions be provided in advance, things educators are legally required to do, they skirt the responsibility. Instead of upholding their duty and legislative requirements, principals have been known to segregate students from their peers, forcibly confine them in small office and classroom spaces, deny their recess and access to outdoor time, withhold their busing, and, in severe circumstances, call the Children's Aid Society if parents continue to send their children in the absence of a valid suspension order. In Hamilton, public health is gearing up for this, sending threatening notices to parents like the one that you're seeing on this screen, enforcing ISPA for the 2025-2026 school year. The only province in Canada pulling this stunt? I would say that's because we're Pharma Central here, sandwiched next to Quebec, and it's really showing. Parents are being coerced into disclosing sensitive health data, or else their kids get sidelined from learning. This flies right in the face of PIPA, the Personal Health Information Protection Act, which is crystal clear. You must give informed consent for anyone to collect or share your personal health information. There is no coercion allowed. But threats of suspension, well, that's textbook coercive, plain and simple. I've heard from parents who are furious, and rightfully so. They're worried about data breaches, and who can blame them? Health records are hacker gold mines. We've seen breaches compromise millions of records across Canada, turning personal information into big business for cybercriminals. Why on earth should parents trust a public health database with their child's medical history, especially when it's tied to something as fundamental as access to education? This confusion between ISPA and the Education Act and PIPA is leaving kids caught in the crossfire. No child should have to choose between their privacy and their classroom. And while exemptions exist, that still means that you're part of public health's centralized database. Plus, if you're considering a statement of conscience for religious or philosophical reasons, remember, the words have to be yours. Don't let public health shove a pre-written form down your throat that includes a potentially self-incriminating warning about putting everyone's lives at risk. That's not your conscience, that's theirs, trying to twist yours. So how do you fight back against this, and especially in Hamilton with public health's bullying and coercive measures? First of all, I would say, know your rights. PIPA is on your side. Document everything, keep records of any communications, and push back by reminding officials that consent is required. Reach out to your school principal and demand clarity. Suspensions can't happen without their sign-off, and only for reasons listed in the Education Act. Join parent groups resisting this. Strength in numbers has shut down nonsense like this before. And if you're facing a suspension order, consider legal advice. Organizations like the Justice Center for Constitutional Freedoms are big advocates for privacy and education rights, and I have reached out to them for a follow-up report, so stay tuned. You can also email me at tamara@rebelnews.com if you'd like to share your story. Notably, I also emailed Education Minister Paul Calandra, the publicly listed media contacts for education, and copied the Premier's office. Despite an entire department dedicated to media relations and a ministry mandated to oversee public education, no one responded. Apparently, those enjoying cushy taxpayer-funded salaries could not muster up the basic courtesy to reply. Ontario students deserve better than being used as pawns in a surveillance scheme. Coercion and bullying have no place in our schools, whether it be among peers or directed at students by the powers that be. For Rebel News, I'm Tamara Ugolini. If you'd like to see more on this topic, head over to stopvaccinecoercion.com. There you can support this kind of journalism, sign our petition, and stay up to date what's happening in Ontario schools with vaccine coercion. All of that at stopvaccinecoercion.com.